हेलो फ्रेंड्स। आज हम लोग कोलिनर्जिक ड्रग्स के बारे में पढ़ेंगे। कोलिनर्जिक ड्रग्स ऑल्सो नोन एज कोलिनोमिमेटिक पैरासिम्पैथेटिक ड्रग्स which produce action similar to that of acetylcholine either by directly interacting with cholinergic receptor or by increasing availability of acetylcholine. These are known as cholinergic drugs. The classification बात करें classification of cholinergic drugs, so they are classified into two types: cholinergic agonists as well as anticholinesterase. Cholinergic agonist, also known as directly acting cholinomimetics, anticholinesterase indirectly acting cholinomimetics. Now this cholinergic agonist is further divided into two types, that is choline as well as alkaloids. In choline we have acetylcholine, methacholine, carbachol as well as butanochol. In alkaloids we have muscarine, pilocarpine as well as aircholine. Now second is anticholinesterase, which is also divided into two types, that is reversible as well as irreversible. In reversible we have carbamates, that is physiostigmine, neostigmine, pyridostigmine, and non-carbamates, that is tacrine, dunpazil, adrophonium. In irreversible, we have also two types, organophosphate as well as carbamates. In organophosphate, we have diphlose, parathione, malathione, tavon. And in carbamates, we have carboxyl propoxer. Now we will talk about the cholinergic agonist, that is acetylcholine. It is not used therapeutically because it has ultra short action, that is half-life is 15 to 20 seconds only, and widespread activity at all cholinergic sites throughout the body. That's why it is not used therapeutically. Mechanism of action: in eye, binds to M3 receptor, contraction of circular muscles of eyes, removes pupillary block, drainage of aqueous humor. As a result, they reduce intraocular pressure. In ciliary muscle, it also binds to M3 receptor, contracts ciliary muscles, pulls scalera spur, improve trabecular potency. As a result, drainage of aqueous humor. Finally, reduce intraocular pressure. In heart, acetylcholine hyperpolarize the SA nodal cells and decrease their rate of diastolic depolarization. As a result, rate of impulse generation is reduced, bradycardia or even cardiac arrest may occur. At the AV node and his Purkinje fibers, refractory period is increased as well as conduction is slowed. SA node bind to M2 receptor and decrease heart rate. AV node bind to M2 receptor and decrease conduction velocity. In lungs, smooth muscles of bronchi bind to M3 receptors and cause bronchoconstriction. Mucus gland bind to M3 receptors as well as cause bronchial secretion. In GIT of smooth muscle bind to M3 receptor and increase motility as well as increase tone of smooth muscles. In blood vessels, endothelium bind to M3 receptor, release endothelium derivative relaxing factor, causes vasodilation. In urinary bladder, detrusor muscles bind to M3 receptor, causes contraction. Sphincter muscle bind to M3, causes relaxation. These are the mechanism of action in different parts of the body. Now we will study about bithanicol. A state of acetylcholine is replaced by carbamate and addition of methyl group. Half-life is 1 hour. Bithanicol activates bowel bladder, mainly M3 action. It is used in post-operative urinary retention. It is used in postpartum urinary retention. It is used in post-operative adynamic ileus. It is used in chronic hypertension of urinary bladder. It is also used in atonic stomach. Adverse effects are the diarrhea, urination, bradycardia, bronchoconstriction, hypotension. Contraindicated: peptic ulcer disease, ischemic heart disease, hypothyroidism, Parkinson disease, urinary obstruction as well as GIT obstruction. Now we will study about pilocarpine. It is an alkaloid that is obtained from plant leaves of Pilocarpus jaborandi. It is a tertiary amine, main M3 action as well as mild action. Half-life is 4 to 8 hours. Uses: it is used in glaucoma. It is used as myotics as xerostomia. Adverse effects are lacrimation, hypotension, flushing, sweating. The mnemonics is flush. Urination also. Anticholinesterase. Now in anticholinesterase we will study about physiostigmine. It is a reversible lipid-soluble tertiary amine which can cross blood-brain barrier. It is absorbed from GIT. Marked muscarinic as well as CNS effect. Duration of action is 6 to 24 hours. Mechanism of action of physiostigmine. It attaches anionic as well as steric site of acetylcholine enzyme. Now this acetylcholine enzyme get carbamylated. It protect acetylcholine from hydrolysis as well as potentiate acetylcholine. Uses. It is used in glaucoma. It is used to reverse the effect of mydriatics after refraction testing. It is used to prevent the formation of adhesion between iris and lens. Adverse effect is CNS overstimulation, paralysis as well as seizure. Contraindicated in Parkinson disease. Why physiostigmine is used in atropine poisoning? It is so because it is a tertiary amine with good tissue penetration, good oral absorption, penetrate cornea, topically effective, has prominent effect on autonomic effectors, has both central and peripheral effect, completely reverse the effect of atropine poisoning, and it can also crosses the blood-brain barrier. That's why physiostigmine is used in atropine poisoning. Now we will study about neostigmine. It is a lipid insoluble quaternary amines which cannot cross blood-brain barrier. Marked effect on skeletal muscles, stimulate ganglia, and short duration, that is 3 to 4 hours. While the duration of action of physiostigmine was between 6 to 24 hours. Uses myasthenia gravis, postoperative paralytic ileus, postoperative urinary retention as well as postoperative decorization. The adverse effects are weakness as well as paralysis. Neostigmine is not used in atropine poisoning. It is so because it is a quaternary amine which is lipid insoluble, so cannot cross blood-brain barrier and has no central nervous system effect. Poor oral absorption, poor corneal penetration, short duration of action. It is just opposite of physiostigmine. That's why it is not used in atropine poisoning. That's all about cholinergic drugs. Thank you. Have a nice day.